Hey, what's up, everybody? Today we're going to be talking about chemo-induced neuropathy, and this is about 20 to 30% of patients that we actually see in the office. Is that after they go through their cancer treatments, if it's chemoradiation or some other form of chemotherapy, then what happens is that a lot of times these patients can develop peripheral neuropathy, and we're going to be talking about why that occurs. We're going to be talking about the different types of chemo and radiation and what they do. The real reason why this happens, we're going to be talking about axonal degeneration, and then I'm going to be talking to you about how we help people reverse this and what expectations should be, and just why all of this makes sense when it comes to the chemo-induced neuropathies, and the little hidden fact behind it about why it really happens, not necessarily because of the nerves, but because of the vascularity changes that chemo-induced neuropathy. Now, forewarning, I am not an oncologist, so I'm not giving any medical advice towards this. I'm just telling you what we see from our examinations and our past patients about what happens to their bodies after they have the chemo or radiation therapies. And so when we talk about this, the acronym for this is CIPN, which stands for chemo-induced peripheral neuropathy. And what happens is that the chemo and the radiation will actually damage the peripheral nervous system and the vascularity. And I don't think many people talk about the vascularity portion of this. I think most people think it's just the nerves that are being affected. But when we talk about correcting it, the vascularity is one of the most important parts to this that isn't getting addressed fully. And I think that this is why a lot of people don't have great results. Now, when it comes to chemo, there are different types. There are taxanes, platinum, and vinca alkaloids. And from my research, what I've found is that it damages the microtubules in the nerves. And these inhibit the transport of these nerve signals. So if you have the numbness feeling, that can be because that when you touch something, or when somebody pokes you with something sharp, or if you feel something that is hot or cold and you can't feel it, then it's the damage done from these chemotherapies actually inhibit that signal from going to the brain because it never gets out of the peripheral nervous system. And so with that, now it also breaks down those microtubules, and those microtubules are what make the nerve and hold its structure. So as you break down the structure of that, they can degenerate even faster. So why that happens is just because of the chemo, because it's so toxic and it inhibits certain processes, it inhibits protein processes, kind of like we talked about with diabetics and glycation. So go check out that video if you haven't seen my diabetic-induced neuropathy video where we break down what causes it actually. Then it's a very similar mechanism, but this one particularly breaks down the microtubules. The next one is radiation, and while this kills the cancer cells, but it can also kill the healthy tissues. So it doesn't really discern between cancer cells and healthy tissues, from my understanding. Obviously, talk to your oncologist, but it's kind of like if you have a war, there's always going to be some sort of casualty, for like civilian casualties. You hope not, but you do your best because you still have to get the bad guys, which are these cancer cells. And when you're damaging those healthy tissues, a lot of the times it's damaging the microvasculature in the hands or the feet. This can also damage, bigger nerves and vessels like in the face or anything like that. I just always talk about the hands and the feet because they're more susceptible to damage because they're smaller. So with the radiation, it's going to also inhibit those healthy tissues, and it damages the nerves, damages the smaller veins and vessels, or smaller nerves and vessels. So with this, now this also has like a half-life too, from my understanding. So even after you get any type of radiation, it's radiation, it has a very long half-life. After you stop it, doesn't mean that the damage still isn't occurring, and that's one important fact that I want people to understand. is that once you get that, that radiation is probably going to be in your body for a long time, unless I don't know of any way that you can detox that out of the body. And somebody else, if you do know, I would love to hear about that. But from my understanding, there's not. And sometimes we'll see that patients, depending on how intense their chemo and radiation therapies are, they can develop this immediately after they have the treatment, or this can be years down the road. And I saw that with a patient recently. They had, chemo radiation a long time ago, but their symptoms started very slowly and they've just continued to progress. And part of that, in my belief, because they didn't have any other factors that really went along why they would have neuropathy, was that that radiation was still working in their body, destroying those nerves and vessels. So how does all of this happen? Well, the biggest point here is axonal degeneration. So you have the nerve cell and the dendrite, and then you have the axon, and that is what actually transmits the nerve signal. And so when you get degeneration of that axon, what's going to happen is that you're going to have either bad signaling, or you're going to have erratic or aberrant signaling. So that means that you're going to get those burning, those tingling, electric-like shock sensations or sharp sensations, because it's misfiring all the time, because it's kind of like something's eating at it. Just like an electrical system in your house, you may have missignaling, like if there is damage to the wires or degeneration to the wires, whether it's like a rat eating it or weather corrosion, whatever it may be, you're going to get that misfiring. And then when it finally gets severed, it's typically when you have numbness and you don't even have any electricity going through. Now, like I said, this inhibits the ability to transmit the signal, and it can also impair the signaling. That's when you get those pain symptoms, sensory symptoms. So like we talked about, all of those kind of align together. And then the worst case scenario, how I would describe nerves, is they are like a jelly donut. So on the outside is where you have the sensory function, and on the inside is where you have motor function. So I talk to my patients a lot about this. When you start to have motor function, you have to have enough degeneration of that sensory function that it's now affecting the motor function. And this is when I get more concerned. A lot of the times we see that from post-surgical, which I'm going to make a video about next. So make sure you subscribe and like this so that you get the notification when that one comes out. But when you have compression down, or you have degeneration of the sensory part of the nerve, you're going to eventually hit that jelly part, and that's going to be the motor function. And that can look like motor deficits. That can look like weakness. That can look like tripping and falling. That can look like decreased mobility. So maybe you can't raise your leg up as high as you once could. And then it can look like complete paralysis. I had to turn away a lady the other day because she had a complete foot drop. And I'm like, I don't think that this is going to be worth your time, because one, she waited too long and there was too much degeneration and we couldn't help. And that's typically when you have like a complete severing of the nerve, typically after, a fall or a really bad accident, or post-surgical, if they, somehow sever their nerve completely. Those are very hard cases to reverse. So motor symptoms are always a worse sign that there is more degeneration in the nerve. Also with this, you can get autonomic symptoms. So you can get erratic heart rates, you can get changes in blood pressure, and also changes in digestion. So if you notice that your heart rate is staying higher than normal, then that can be because the damage to the nerves in your heart could be due to the chemoradiation, or changes in blood pressure as well, because there is all of that signaling up to the brain that regulates your heart rate and your blood pressure, and then also your digestion. And a lot of these come, from the vagus nerve, and that's out of your cranial nerves. And you never want to see these, because these can indicate that we either have damage to the actual organ, we actually have damage in the peripheral nerves that go to that, we have damage in the spinal cord, in the midbrain, or even in the higher brain. And that's kind of your differentials when you're talking about neurological problems and the autonomic nervous system, especially with autoimmunities more so, but it can happen with this. And Like we talked about throughout the video, there can be a gradual onset of this. It's not always that you have the treatment and then it becomes. There are so many factors that go into this, and it's so important that you understand that, one, if you're a bigger person, you're probably going to be able to handle more treatment. If you're a smaller person, probably not. You're probably going to be more susceptible to it. If you have lifestyle factors such as drinking and smoking, then a lot of those can contribute and make the issues worse as well. And they can increase your chances of developing neuropathy. Then it comes to diabetics, if you have any type of injuries, autoimmunities, and all of these are what we're going to be covering in this series where I talk about all of the common causes of neuropathy. Now, how do you address this? Well, part of this is that you do have to deal with the half-life of radiation if that is an issue, but what do you have to repair? You have to repair the peripheral nervous system and you have to repair the vascularity. A lot of this is done with low-level light therapy, which causes angiogenesis to restore the vascularity, and then electrical stim to help that peripheral nervous system uptake oxygen and nutrients. Now, we do different things here in the office. We do oxygen therapy, vibration therapy, we do decompression, we have light therapy as well, and then nutrition to support this as well. Because you have to, if you're going to rebuild the house after it weathered a storm, you have to have all the right materials, and most people's diets just aren't good enough, or it would take a very long time, rather than doing like what we call therapeutic supplementation to give the body exactly what it needs to make this process go a lot faster. Now, it's not an easy process by any means, and just to set appropriate expectations, most of our patients are a minimum of 9 to 12 months in order to get rid of this and to actually treat it appropriately. And so when we talk about appropriate expectations, if you're expecting to be better in 2 to 3 months, it's probably not a reality, even if you're only doing one of the things that you need. You have to have a combination and the therapeutic effect of it all in order to get the best result. So I hope this was helpful. Share this with anyone in your family who may be suffering from neuropathy, whether they have diabetic induced. You can go back and share the other video with them, or if it's chemo induced, share this video with them so that they can understand it. And if you have any questions, please just put them in the comments below or reach out to me. I'm more than happy to help. I want to help people understand how they can recover for this, and that there is hope that they can recover from their neuropathy. So thank you so much for watching this video, and I will see you all next time. Please subscribe to the channel, like this video. It helps me to make more channels, and I would love to hear your feedback about it as well. All right, everybody, have a great day. Bye.